the American Heart Association is urging people not to be afraid to see their doctor if they don't feel right. Since the COVID-19 pandemic began, hospitals have seen about a 40% drop in visits to the emergency room. The Heart Association's Don't Die of Doubt campaign urges people not to ignore signs of heart attack or stroke. Our guest took that advice, and it may have helped save a life. Joining us now is Jerry Chiaverini, who had chest pressure but didn't want to bother busy doctors. And his wife, LoraLee, is a registered nurse who convinced him to have it checked out. And thanks to both of you for being here. Really nice to have you here. And Jerry, especially nice to have you with us.
Yeah, thank you very much.
Maybe you could start by just telling us when you first began to feel like something was not right with your health.
Well, you know, I took a bike ride and I was into it for about a mile, and I started getting this like almost a discomfort in my chest, almost like a indigestion. And so I stopped. I took a couple of deep breaths. I had some water. It went away, so I continued with my bike ride, and I rode probably about 15 miles. Went home, took a little bit of a break, cut the grass, and it really never reoccurred again. So I didn't think too much of it. I did mention it to my wife a little bit that what happened, and then a couple days later I took a walk, and I was walking, and I had the same kind of discomfort. And so I told my wife, I said, you know, I had this happen again, you know, and you know, I'm not really sure, you know, what it could be in that. So she was thinking, and then I sort of let it go a little bit, and then I cut the grass on a Saturday again, and then it came back. So then I talked to her about it again, and then that's when she said to me, you know, I think, you know, we should get this checked out. She said, the American Heart Association has a new campaign, Don't Die of Doubt. And she says, you know, this keeps going over in my mind. And she said, you know, I think this is something that, you know, you should take serious. And well, then I did, and we did call the doctor on call, and he explained to me that it could be heart disease. And so then he said, come in for some tests, take it easy. If you have more, go to the emergency room. But you know, and then Monday I did go in, and then they did the tests, and then following Thursday and Friday I did more tests than that. So, and then they found out that I did have blockages, and I needed to have a bypass of that. So.
Wow. Now, LoraLee, you're a registered nurse, I understand?
Yes.
Were you immediately concerned when Jerry started telling you about the symptoms that he was having?
Not immediately concerned, because I think you kind of want to deny that there could be something seriously wrong with your loved one. And so he described it as indigestion the first time, and he was able to complete his 16-mile bike ride. The second time he mentioned it, it caused me a little more concern. And the Wednesday before, I had gotten an email at work asking for us to participate in the Don't Die of Doubt campaign. And unfortunately, I was not able to participate in that campaign, but the name of the campaign kind of stuck with me. So then I saw it on social media as well, and then that Saturday, and he mentioned it to me now for the third time. He was sitting in a chair in the living room. I had my shoes on. I was ready to take him to the emergency room. He was hesitant, and I just said, Jerry, I don't want you to sit here and die from doubt. I said, we have to do something and get this checked out. And so then at that point, he did agree.
Now, of course, we're in the middle of the COVID-19 pandemic. Jerry, was that part of the concern that maybe prevented you from going in earlier than you did? Were you cautious about going to a doctor at that point?
Yeah, you know, it always comes up in your mind. You don't want to unnecessarily go to the doctor unless you have to, you know. And you know, with the pandemic, that's even more, you know, prevalent now. So that was one of those things. Well, I just didn't want it to, you know, be something, you know, simple, because you have to go to the emergency room, and you know, you're in contact with, you know, I mean, there's other people in the emergency room. So that did have a bit of a factor. But you know, now knowing that, you know, St. Luke's has a great process. They made me feel really safe when I did go in for my procedure and that. So it's again one of those things. So you don't have to worry about that. They take precautions in that.
Mm-hmm.
So.
With heart attacks and stroke, always the message is that time is of the essence. By the time you went to the doctor, was there a real urgency for the surgery to occur, more so than if you had gone in a week earlier?
Well, yeah, they wanted to take care of it as soon as they could. So then that's when they decided, well, then a week later that I'd go in and have it. Of course they told me to take it easy, and I had some medication that I was taking. Of course, if anything came up, I was supposed to go in to the emergency room if anything got worse than that. So, but I didn't make it, and then the Friday, August 7th, and that's when I had the bypass.
Mm-hmm.
Yeah.
Was it at an urgent space where he could have potentially died?
Yes, absolutely. Dr. Mary Boylan was his surgeon, and her exact words to us were, he was riding on a cliff, and it was simply a matter of time, and not a lot of time. So it was very, very important that he got the care that he did and when he did.
Mm-hmm. What kind of protocols were in place when you went into the hospital that maybe reassured you that things were in a good place as far as being there with the COVID crisis in place?
Well, it's just that they have mask wearing masks, and they just sort of walked you through it of how they wanted you to, they gave us a good information on what to do, in the sense, so you didn't feel like you were exposed or threatened by the COVID and that.
As a nurse, are you seeing fewer patients coming in for office visits these days?
Well, I work in the Coumadin Clinic at St. Luke's, and we actually initially were seeing quite a reduction in people coming in. They were very concerned about getting their routine blood tests, and St. Luke's came up with a drive-through, a mobile lab, so people only had to drive up and put their hand out the window, have their blood tests done, and be on their way. So that really dramatically helped our population, because they were very concerned about actually walking in. Mm-hmm. And if they don't have to, they're happy about that.
Mm-hmm. And are you getting the sense from talking with your colleagues in healthcare that it's a real concern amongst professionals that people are not coming in and getting the care that they need?
Absolutely, yes, yeah. And that's something else that Dr. Boylan had mentioned to us, is that people are not coming in, and that for Jerry it was a circle that was very important, that it all happened as it did. He recognized the symptoms, he talked to me about it, I had this Don't Die of Doubt campaign in my mind, and we acted on it. Mm-hmm. And if any one of those steps didn't happen, the outcome could have been very different. So Dr. Boylan was saying, again, how very important it is for people to still seek medical care in spite of the pandemic.
Mm-hmm. Did the American Heart Association reach out to the two of you to share your story?
Yeah, they
How
did.
Did that come about?
Well, I think they saw it on Facebook, and my wife put it on. It was on Facebook, and I think they saw it there, and then that's when they saw the story, and they thought they would get in contact with us and see if we'd tell the story. And when they contacted us and they said, about tell your story, I thought, well, if I can help one person, get in and get taken care of, so they have a good outcome, that would be the thing to do. And they do such a great job of getting, messages out and getting, having different campaigns, and so I thought, wow, this would be a great thing to get people to act, and go in and get taken care of so that they don't have a bad outcome.
Mm-hmm. How does it feel to be in the spotlight?
I find it a little uncomfortable. We are not used to this at all. But I agree with Jerry. I mean, he was very passionate about that this is something very important. The message has to get out. The message resonated with me, the don't die of doubt. I talked to him about it, and I truly believe that was the catalyst that got him to agree to pick up that phone and call the doctor.
Mm-hmm. And what are the main message then to our viewers who might be putting off going to a doctor or hesitating when they feel some symptoms?
Don't hesitate. I added my own tagline, don't die of doubt, check it out. Mm-hmm. And that's not only in relationship to heart disease, but to any health concerns. I would not put off health care at this point.
Mm-hmm. And Jerry, where do things stand right now? Are you 100% healthy
yeah,
again?
well, right now
I'm
8 weeks, from surgery. So I'm doing good. I'm doing rehab. I'm feeling good. I still have to take it easy so that I can heal up. Mm-hmm. So I have another about 4 months before I'm can do anything I want to do.
4 weeks.
4 weeks. I'm sorry. 4 weeks. Yeah. And so again, everything that went at St. Luke's was a great experience. They took very good care of me, made me very, very safe, and I couldn't say enough of good things about St. Luke's and the care I had, and still the care I'm getting from the rehab and that. But yeah, I think that people should, take it serious, and if you have something, get it checked out.
All right. Well, Jerry and LoraLee, thank you so much for coming in and sharing your story, and thank God you were on the ball with that. It's really a heartwarming story.
Yeah, well, thank you very much.
Thank you.
Yes, thank you for having us.